energy, otherwise I'll sleep. All right, Dr. Aisha, are you ready?
Yes, ma'am.
Yes, I'm starting the timer, and here is the question. Right. So if you have read and understood, kindly begin your examination.
Okay. First of all, I'll gel my hands and then I'll start with introduction of myself and
Yes.
I'm on the registrar
Yes.
and I will then the name and age of the patient.
Yes.
After that, I explain the procedure to the patient in detail. That's what I'm going to do with him or her today. I'll
Yes.
examine him walk and having a look and feel of his foot and then doing some movement of his foot or ankle joint. And I'll take a consent from him that is okay or fine, and then
Yes.
ask for exposure. I'll ask the patient that he could take it down off. After grasping the informed, then I'll ask the patient to walk. If it's not painful, then he could walk 2 steps from me, and then I'll observe the gait and symmetry and smoothness and any deformity and his balance. Then I'll ask the patient to if they can stand on their toes. Mm, and if I'll stand nearby the patient so that if they don't maintain their balance, I can just hold them. Then I ask the patient to if they can stand on their heels, and again I'll ask the patient to stand on the inside of foot and on the outside of foot as well for me. Then I'll
Okay.
inspect from the front, from front for any scars, any swelling, any visible veins, any hair loss and any joint swelling. Here, there could be possible there are stab avulsions as in the dressing which can I seen on the right shin area. And then I'll ask the patient, after this, I'll ask the patient to, that I'll examine him from the side for any, mostly the foot arches, the median and longitudinal, and the swelling, erythema, scars, for all the things, and from back for Ashley's tendon and for symmetry and all that. Now I'll ask the patient to lie on the bed and tell him that I'm going to perform some movements. If there's any pain, then he could stop me from that movement. Then first of all, I'll start with assessing the temperature of both his lower limbs by with the dorsum of my hand, and after that I'll palpate the pulses at the phallus periods, which can be found in between the first and second metatarsus, and then posterior tibial pulse, which is can be found behind the medial malleolus. And then I'll palpate the joints, including the lower end of tibia and fibula, the ankle joint, the calcaneum talus, all the bones, and the metatarsus, and then the phalanx. Then while examining all these, I'll be looking at the patient face to for noticing any discomfort, and I'll then palpate also the tendons. After that, I'll ask the patient if he could bring his toes up in the air as much as possible and then back down like pushing or pressing on a car pedal. After that, I will passively assess his plantar flexion and dorsiflexion myself while holding the joint, the patellar joint, and then I'll grasp the ankle of the patient, right ankle of patient with one hand, and the heel with heel with the other and then I'll move his sole towards the midline and to check the inversion and then away from the midline to check eversion. Then I will examine the flexion and extension of each digit myself while making sure that it's not painful. And then I will go for the anterior draw test of the ankle which is basically test to check the anterior talofibular ligament. I'll ask the patient if they are sitting up in sitting up position, and with the 10, if they can do 10-degree or a bed plantar flexion, that they can move their toes up in the air. And I'll stabilize the tibia with one hand and cup the heel with other hand and apply an anterior force to the foot. Any asymmetry in the movement of the hind foot in the foot will result in the will tell us that there is an injury of anterior talofibular ligament. And then I'll go for another test, which is stellar tail test in the ankle joint examination. While the patient sitting over the knee flex at 90 degrees, a force will be applied, which will be can be a valgus force or varus force. Valgus and varus force will be applied at the ankle joint with one hand, and I will be cupping the heel with one hand, and I'll holding the tibia with the other hand. Any asymmetrical opening up in the valgus stress will indicate that deltoid ligament injury, and if there is any asymmetrical opening up in the varus stress, that will indicate a calcaneofibular ligament injury. Then there is one test left, that's a Thompson squeeze test. I'll ask the patient to kneel down on the chair with the feet hanging off the edge. I'll squeeze each of the calf in turn, and I will normally the foot should plantar flex. But if there's any tendon injury of the Achilles tendon, there will be no movement. And then I'll like to examine the knee joint as well and the hip joint, and I like to do the neurovascular examination of the leg.
Okay, very good. So what would be your differential diagnosis? Still have 30 seconds. Good. Your differential diagnosis?
A patient has, as he has numbness,
Yes.
and there may be some injury of the nerve here. And
okay. How would you investigate?
I'll go for, first of all, I'll complete the neurovascular examination.
Yes.
And then after that,
yes.
to rule out.
Voice has disappeared. Yes, please.
Which it is a neuropraxia or a neurotemesis
yes.
or and then accordingly I'll manage.
MRI. Okay. What should be the treatment?
Treatment should be initially the support should be provided in
yes.
the normal cervical position of the limb.
Yes.
After vitamin B12 and folic acid for those if it's a neuropraxia so that it can heal, and after that it should be referred to plastic surgeon for the treatment according to the stage of the injury.
Very good. Okay. Good.
Ma'am, I need to ask one question.
Sorry?
I want to ask one question.
Yes, please.
Most of the time, the scenarios in the past papers are not complete. So I don't get by only the scenario. So means I don't know that these details can lead to definitive diagnosis in the scenario.
Yes. They write very clear scenarios in exam. This is what everyone has told me. So even if someone has given exam late, when they want to get the credit, okay, they come here and we give them the credit. And then what I've come to know, they write very clear scenarios. So once once a scenario will be given, they'll tell you exactly what they want you to do. So Dr. Abhishek has raised hand. Maybe he can explain more better than me.
It's actually about the examination. Can you please go back to the STEM?
Yes.
Yeah, Dr. Aisha, actually here see the scenario like patient had some kind of a radio frequency ablation, right, for the varicose vein actually. So in that way, patient had some injury over the common peroneal nerve or maybe over the common peroneal part of the sciatic nerve, something like that. So actually patient may have numbness in the anterolateral aspect of the foot and loss of dorsiflexion. And in this station, we are allowed to do the neurological one examination. Okay, and you can check the other ones what you have done, but at first focus on the neurological examination. like, and the special test, the Tinel sign is very much important. You have done that, right?
Sorry.
Hello.
Just
The Tinel sign, you have checked that.
No.
Okay. Okay, and you have to check all the neurological things like tone, coordination, reflexes, and you can see the sensory and motor function of the ankle. And then the special test, you have to also check the Tinel sign. And at first begin with the temperature tenderness. I'm just saying that. And what you have done actually, that's the acute injury. Patient had got some injury over the ankle. There may be ankle swelling, and that may be a case of ankle sprain. Okay,
Yeah.
you can get me, right?
I'm sorry to interrupt you, Mr. Abhishek. I just want to ask this, that I just get confused with the scenario, what they're asking for. Today, as I know that I have to go for the ankle examination, so I just started.
Yes, ma'am gave, yeah, you asked for ankle examination, but
Yes,
ma'am
but
gave
I
you the
gave you
foot
foot
drop
drop.
examination. Yeah, these two
Sorry.
different stations.
There are two different stations. I announced before I came that I've forgotten who asked for what, but then okay, I asked her now differential diagnosis, and then she could have thought. But Dr. Aisha, you'll practice with us and you'll become used to it, because I don't give the scenarios which are given in the notes. I have my own, but then I play around with the topic as well, little bit. Not intentionally, but it just happens. Yes, sorry.
And in the exam, you will also be able to know about that you are supposed to do the neurological one, or you are supposed to
Yes.
do the orthopedic one, because there will be some kind of neuro tip, the ankle hammer, all the things will be available in case of neurological examination. Okay, you can take hints from there also.
And it will be given clearly in the statement.
Clearly.
What they want you to do. Okay, so there'll be no confusion. And there are certain foot drop comes. This came in Bahrain. I don't know, many people, or one or two at least, they told me the whole story. So, and young girl comes, actor. So that's also, so you have to be prepared. Was it foot sprain or foot drop? I don't know, something foot examination comes.
Ma'am, in adult age, I guess, ma'am, it may be a case of ankle sprain, and in case of varicose vein, previous surgery like this, radiofrequent ablation, or any type of injury.
Varicose veins, this came in Egypt, but this foot examination came in Bahrain. But now, since they are not having these international exams, so we have very limited stations which came in UK and Dublin.
Please
In
go
October.
through that, ma'am. Yeah.
So just go through those. Just until you people said to follow what this rubbish schedule, so I'm following it. Yes, otherwise I want to practice those most common ones. So
yes, ma'am,
even you do it again and again, get tired of doing it, but still if we do that, it will help you. People, at least
yeah, well, like the most of the people are appearing in February. I think the most common,
Dr.
and
Aisha,
it's
are you
only
also
in
appearing?
Ireland. Yeah.
Is she